So EBV positive PTLD is a very rare complication of both hematopoietic stem cell transplantation recipients, so allotransplants, and also solid organ transplantation recipients. It has quite a dramatic course with the treatment strategies that we have. And the incidence, of course, varies between stem cell transplantation recipients, solid organ transplants. Less than 5% of allogeneic stem cell transplantation recipients develop these complications. Between 1 and 33% of the solid organ transplants develop PTLD. So not all the patients that are being treated with an allotransplant or a solid organ transplantation have the same risk to develop PTLD. If we talk about solid organ transplant, we have to take into consideration the organ that has been transplanted. If we talk about hematopoietic allogeneic stem cell transplantation, then we have to take into consideration basically those patients that are highly immunosuppressed, those patients that have a higher mismatch between the patient and the donor. So basically haploidentical transplants are at a higher risk of developing EBV positive PTLD, and also differences in terms of EBV between donor and recipient. A significant proportion of these patients are not going to respond, or eventually they respond, but then they relapse later on. Before, let's say, the newer times, we were using conventional chemotherapy for these patients. Nowadays, we have the possibility to use EBV-driven cellular therapy approaches that have demonstrated that are able to achieve a high complete remission rate, prolonged survival of these patients with a very mild and adequate toxicity profile. What is very important is that we have awareness of this disease, that we try to follow especially carefully patients that are at high risk of developing this complication, and that we are able to refer these patients as quickly as possible as they are being diagnosed or they fail first-line treatment strategy for further treatments.